Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We'll be discussing priapism. Priapism is defined as a persistent and painful penile erection lasting more than 4 hours, occurring without sexual desire or not resolving after ejaculation. In children, it is often associated with sickle cell disease. In adults, it may be caused by drugs, trauma, neurological or hematologic disorders. Types of priapism. A. Ischemic, low flow. Priapism, most common, over 90% of cases, caused by obstruction of venous outflow, leads to trapped, deoxygenated blood, very painful and rigid. Medical emergency P. Non-ischemic, high flow. Priapism, less common, caused by unregulated arterial inflow, typically post-trauma, less painful, partially rigid, not a medical emergency. C. Stuttering, recurrent. Priapism, repeated episodes of ischemic priapism, common in sickle cell disease, often self-resolving but may lead to fibrosis. Causes of priapism and their examples. Categories. 1. Hematologic. For example, sickle cell anemia, leukemia, thalassemia. 2. Neurological. For example, spinal cord injury, multiple sclerosis. 3. Medications. For example, trazodone, sildenafil, Viagra, antihypertensives. 4. Substance abuse. For example, cocaine, alcohol, and marijuana. 5. Trauma. For example, pelvic or perineal injury. 6. Metabolic. For example, diabetes mellitus. 7. Idiopathic unknown, cause in 30–50% of cases. Signs and symptoms include 1. Prolonged erection. 2. Pain. 3. Penile rigidity. 4. Swelling. 5. Urinary symptoms. 6. Duration. Risk factors. 1. Male gender. 2. Children aged 5 to 10 years, sickle cell related. 3. Adults aged 20 to 50 years. 4. Hemoglobinopathies. 5. Intracavernosal drug use. 6. Substance abuse. 7. Penile trauma. 8. Neurologic disorders. 8. History of priapism. Pathophysiology of priapism. Normally, an erection involves increased arterial inflow and restricted venous outflow. In ischemic priapism, the venous outflow is obstructed or fails to occur, causing blood to be trapped in the corpora cavernosa. The stagnant blood leads to hypoxia and acidosis, which cause pain and risk of tissue damage. Prolonged ischemia, greater than 4 to 6 hours, can cause fibrosis of the smooth muscle and erectile tissue, potentially resulting in permanent erectile dysfunction. Diagnostic tests. 1. History and physical exam. Onset, pain, drug use, trauma. 2. Blood gas analysis. 3. Ischemic, saturated oxygen. Reduced, saturated carbon dioxide increased, pH reduced 4. Non-ischemic, normal 5. Color Doppler, ultrasound, detects blood flow and AV fistula. 6. CBC, sickle cell, leukemia. 7. Toxicology screen, drug-induced cases. 8. Urinalysis and serum chemistry. Assess metabolic causes. Management A. Medical management. 1. Hydration. 2. Pain control, NSAIDs, opioids. 3. Ice packs for non-ischemic B. Pharmacological management. 1. Phenylephrine A agonist, intracavernosal injection. 2. Hormonal therapy or PDE5 inhibitors for recurrent cases. Surgical management. 1. Aspiration and irrigation, immediate relief. 2. Surgical shunting, create an outflow route. 3. Arterial embolization. In high-flow cases, nursing management. 1. Monitor vitals. 2. Administer meds and pain relief. 3. Provide privacy and emotional support. 4. Educate the patient on medication and follow-up. 5. Document care and patient response. Prevention includes 1. Sickle cell management. 2. Avoid misuse of erectile medications. 3. Prevent trauma. 4. Educate high-risk groups. 5. Regular monitoring in chronic conditions. Complications. 1. Erectile dysfunction. 2. Penile necrosis. 3. Infection. 4. Psychological distress. 5. Recurrent episodes. In summary, understanding priapism is crucial for its timely diagnosis and management. Always consider the underlying causes and address them to prevent further complications. That was quite informative. I didn't know priapism had so many types and causes. Yeah, and the connection with sickle cell disease was really interesting. I need to read more about it. Drugs and trauma, too. Makes you think about how interconnected our systems are. Thank you for joining today's session. Do not hesitate to reach out if you have any lingering questions. Remember, effective learning comes with curiosity and engagement.